Hi, my name is Dr. Jonathan Huber. I'm the current medical director of Toronto Hair Transplant Surgeons, and I'm also one of the partner surgeons there, along with my colleague, Dr. Ashlyn Alexander. Today, I want to talk to you about something that you might never have actually heard of before, and that's the use of ATP in hair transplantation surgery. So, we're going to talk about what it is, why we use it, and why we at THTS now think you should not even have a hair transplant without this. We are also going to talk a little bit about it, and I'm going to take you behind the scenes a little bit in terms of how we make these decisions when we decide to include these types of things in hair transplantation, and even open the door a little bit to help you understand some of the limitations in hair transplant research and what other hair transplant clinics aren't telling you. Okay, first of all, what is ATP? You might remember this from your high school biology class when you learned about the Krebs cycle. And I promise I'm not going to lecture about the Krebs cycle today. But basically, you can think about ATP as the energy currency of your body, or more simply, the fuel that runs your car. Just as your car needs some kind of fuel, whether it's gas or electrons, in order to go, your body needs energy in order to do stuff, even just simple act of metabolism. And believe it or not, your hair follicles are one of the most metabolically active organs in your whole body. So think about it. This is an organ in your body that is constantly growing and then sometimes shedding and even growing again. These cells are constantly reproducing, even for years and years and years at a time without stopping. So they require a lot of energy. Where the problem occurs is when we take them out of your donor area at the back or side of your head, temporarily put them in our dish, and then replant them into your recipient area. Why is this a problem? Because we've disconnected those follicles from your blood supply, and it's your blood supply that delivers this ATP to the follicles. In a transplant, those follicles are maybe even under more stress than usual, and they probably need even more energy to survive. It's not until about 3 to 5 days after your transplant that those blood vessel connections are actually made to resupply your transplanted follicles back to your scalp's blood supply. So that's where exogenous ATP comes in. That means ATP from outside your body. That's the role of that kind of ATP. While those follicles are sitting, very temporarily in a dish waiting to be transplanted, we at Toronto Hair Transplant Surgeons are bathing it in a solution of ATP. And then in the critical 3 to 5 days after your surgery, we're supplying you with an ATP spray to spray directly on your follicles as a means of giving them that energy in that high stress environment that they're finding themselves in at that time. Now, here's where I want to shed a little light on some of the kind of dark secrets, so to speak, about research in hair transplantation and how we make these decisions. And then we'll get back to talking about ATP, I promise. So, when you think about research in medicine, you're probably thinking about research in things like cancer treatment or heart disease prevention, or some of these really large research study that involves sometimes thousands or even tens of thousands of patients conducted over years and years. And this type of research gives amazing answers to those types of questions for those types of health conditions, but it's expensive. And that kind of research is usually backed by university research foundations or charitable foundations or organizations that can really support that kind of really, really expensive research. In the hair transplant world, unfortunately, we just don't see that. Research studies, even in hair transplantation, are very expensive, but there's no major charitable organization, there's no large university foundation that's funding these kinds of studies. In some cases, the studies are funded by the doctors themselves who are doing the research, or maybe by the companies that are producing equipment or other treatments used in hair transplant surgery or in hair restoration. But generally speaking, what that means is that these research studies are small and maybe they don't give us quite the precise answers that some of these really huge research studies you might be hearing about give when answering those types of questions. So, what does that mean for you and for your hair transplant? What it means is that it's our job and our responsibility to wade through all this information and keep updated, which is something that Dr. Alexander and I do, and use the best available information we have about whether we should do or not do something in hair restoration or hair transplantation. And when it comes to ATP, we've made the decision recently that ATP is beneficial for hair transplant patients. And we think at this point that if you're going to have a hair transplant, you should be benefiting from ATP. For example, a study by Cooley in about 2010 showed that graft survival rate increased by a whopping 28% in extracted grafts, even when those grafts were left out of the body for up to 5 days. More recent study in 2023 by Zhu showed all kinds of benefit to ATP. For example, less graft shedding, a delayed onset of graft shedding, a shorter interval or shorter duration of graft shedding, quicker growth of your grafts, and even just overall increased patient satisfaction with their hair transplant in patients where ATP was used compared to where ATP was not used. Are these studies of the same quality of the kind that are studying cancer prevention or heart disease treatment? No, of course not. But given what we know about the use of ATP, at this point, we think every hair transplant should have the benefit of ATP during that transplant. And if your clinic or your doctor or your surgeon is not offering this to you at this point, I think you should just move on. So, if ATP is so great, why isn't every clinic using it? And the reality is that ATP is really expensive. There's, in fact, only one company in the entire world that makes it, and it's located in Europe. It has to be shipped in cooled boxes, and it doesn't last very long. So you can't order a lot of it and store it for a long time and then use it. You have to order small quantities at a time, get it shipped from Europe, store it properly, and then use it in your surgery. Yes, it adds a little bit to the cost of your surgery. And yes, it means you have to do a little bit more in those really critical 3 to 5 days after your surgery. But at this point, we think it's worth it. And if your clinic isn't talking to you about this or isn't using it in your surgery, again, we think you should move on to a clinic that uses this. By the way, if you like this kind of content and you want to see more of it, please let me know. And really, the only way that I know that you like it and want to see more of this is if you subscribe to the channel or like the video or add a comment below or even do all three. When you do that, I know that this is the kind of stuff you want to see, and I'll spend my time making more of this kind of content. If you want to talk about ATP or just your hair loss in general and how we can help you fix that, please go to www.torontohairtransplant.com. I'm sure we'll put a link down below, and we'd be happy to talk to you about anything you need.